I'd like to thank the organizers of the Closer Conference for inviting us today to talk to you about the work that the Environmental Influences on Child Health Outcomes program has done to engage a diverse set of stakeholders using a diverse set of strategies. I'm Elissa Faro, and working together with Amber Anderson, we're going to talk to you a little bit today about some of the work that we've been doing. To start off with, a little bit about the ECHO program. ECHO is a longitudinal cohort study that was funded in 2016 and will be going until early 2023. So we are in early in year 6 of the 7-year program. And I just want to note that ECHO is slightly different because the US doesn't have a singular national healthcare system. And so ECHO is one of the creative solutions to put together a cohort of cohorts to look at a large sample of the population. ECHO's mission to enhance the health of children for generations to come is supported by our long-term goals, where we simultaneously focus on both scientific and strategic goals, such as informing high-impact programs, policies, and practices that improve child health, establish best practices for how to conduct team science in the 21st century in the new world we live in, and to answer crucial questions about the effects of a broad range of early environmental influences on child health and development. And to give you a sense of some of those influences, this slide shows a little bit about the breadth and scope of what's possible in ECHO in terms of science. And so we're looking across the life course, across all of these spheres, from biological all the way to physical and chemical exposures, and across a broad range of outcomes, including the kind of novel concept of positive health. And now to give you a sense of what that ECHO-wide cohort looks like, we have data from almost 100,000 participants from 72 different cohorts, and that consists of almost 60,000 children, and we've collected 42,000 biospecimens already and are still continuing to collect for the next couple of years. Among that group of participants, we see diversity in age, socioeconomic status, geography, and race ethnicity, which is broadly representative of the US population and gives us a nice sample to do research with. Additionally, it's the hope that this data set becomes a nationwide research resource. So in the future, we'll be posting a controlled access use data set coming up in the first half of 2022. So the ECHO stakeholders are a multi-level heterogeneous group. And today we're going to focus on just a few. They're all important, but we only have a limited amount of time. And so as you see in the middle, participants and families are the stakeholder group that we as researchers most often think of, but there are many different stakeholders at different levels with different interests and connections to the ECHO work. And so that engagement includes both front-end and back-end collaboration. We want to work with organizations to determine gaps that can inform solution-oriented research questions, as well as to disseminate results when we have findings to share. Starting first with those participants and families, we have a broad range of ways that we engage, from the participant experience survey, which is now part of the ECHO-wide data collection protocol, to having participant representatives inform a broad range of ECHO work, from policies related to returning results to different types of communications materials. Additionally, there is a wide range of cohort engagement, from investigators that have long-term ongoing involvement who are almost embedded within their stakeholder communities, to investigators and cohorts with more newly formed cohorts who are early in the process of building relationships with their participants, their families, and communities. Now, not that the other forms of engagement aren't supported by and in support of research, but here on this slide, we want to talk a little bit specifically about engagement that is usually led by ECHO investigators together with stakeholder groups who are specific to their content area. So for example, you see here this obesity document, one of the ECHO outcomes. This work really was catalyzed in early 2019 by the ECHO-wide Strategic Planning Task Force, who started this with an environmental scan that involved multiple rounds of contributions from groups across ECHO. And then after distilling some of those findings down, the Stakeholder Engagement Working Group created what we're calling stakeholder gaps documents, which were shared with the outcome working groups to help them understand what some of the research gaps and priorities from stakeholder organizations might be. This is meant both to encourage investigators to think about those priorities as they're developing new research proposals, as well as to when they're disseminating findings from their research with groups with whom might be in particular find their work most relevant. And so additionally, one of the ways that the investigators do that is at conferences like the Pediatric Academic Societies in 2022, which is going to feature an ECHO symposium. The NIH ECHO Program Office leads outreach to over 90 organizations of national and professional and advocacy groups through a broad range of tactics, from different types of meetings to different types of communication materials, such as the ECHO Connector, which is a newsletter you see an example of from on the right, to webinars, to different types of web content, to personalized outreach to different stakeholder organizations when research findings might be particularly relevant. So that was just a brief overview of some of the types of ways that we are engaging with ECHO stakeholders. And after 5 years or so of doing this, we have a few lessons learned or sort of reflections. The first of which is that it's really the collective responsibility of everyone in a research program to build awareness about the different stakeholder groups and their interests, as well as building capacity to engage appropriately and meaningfully with those groups, both early and continuously throughout the course of the project. And a big part of that is providing the infrastructure and support for engagement, some of which I've already discussed, but also things like working with the research community, such as the Idea States Pediatric Clinical Trials Network, so that the ECHO observational research findings can inform future interventional research. Also, we've learned that one size does not necessarily fit all. So sometimes we need to use different strategies and different media and ensure that different messages are reaching different stakeholder groups so that they get the right information in the right way that is most useful for them. Looking ahead, within the final couple of years of ECHO, some of the ways that we're building on this engagement work is that engagement with stakeholders is now actually part of the annual program evaluation and is collected as an indicator. And so the dissemination to relevant stakeholder groups is both tracked but also supported ECHO-wide. The Stakeholder Engagement Working Group continues to build capacity with investigators, such as working with them early in the development of new analyses to be thinking about those priorities of stakeholder organizations. And then our ECHO Coordinating Center Communications team is continuously developing new media and templates so that ECHO investigators can reach different groups, such as social media. We have a new Twitter handle at ECHO Child Health. Please follow us if you Twitter. And then finally, I'd just like to acknowledge the contribution of the entire ECHO scientific and stakeholder community. There are a number of groups across ECHO that have served the foundation as the foundation of this presentation. But in particular, we would like to thank our ECHO colleagues, the medical, nursing, and program staff, and most importantly, the children and families participating in the ECHO cohorts, without which none of this would be possible. Thank you again for having us today. I look forward to questions and a lively discussion in the live session.